Right? I mean, if you look at the French, right, they've always eaten highly palatable foods, right? I mean, much smaller portion size, much more locally grown. But they would never eat in between meals. They would never eat walking down the street. They would never bring food to work or into the classroom. So we had certain boundaries. I mean, yes, we had highly palatable. We had desserts once in a while. I mean, occasionally. I mean, now we're eating literally. I mean, the average 2-year-old, right, compensates for their eating. Right. What I mean is, you give them more calories at lunch. They'll eat fewer calories later on during the day. By the time that child is 4 or 5, expose them to a Western diet, they lose the ability to compensate. They're eating constantly throughout the day. We've made it socially acceptable to eat any time. We've taken highly reinforcing stimuli. We've taken highly reinforcing stimuli, and we've put it on every corner, and it's okay to eat throughout the waking day. And that has, and you've seen it, and I can show you, I mean, that has real effects on our neural circuitry. Not everybody is equally sensitive, but there, I mean, I think that you have to realize there are millions of people who want to control their weight, right? Who, if it were just diet and exercise, of course they would do it. The fact is, it's not just hedonism, it's not just liking. The stimuli are very powerful, and it really, it creates this wanting. Your brain gets activated, the cues stimulate you, it's thoughts of wanting, there's arousal, there's this preoccupation. And then you eat, there's this momentary pleasure, and every time you do it, you strengthen the neural circuits.
But people have been like that since we've had people.
But we had certain boundaries.
But was it the addition of high fructose corn syrup and cheaper sugar? Was it the addition of trans fats? Was it something else that made it socially acceptable, or did
to eat any time of day?
Well, who's the we? Society must have changed it, not any one person.
If you went down, if you mapped out, the streets around this hotel back 4 decades ago, you would not see the same kind of delivery of food. People ate during meals. We had certain built-in boundaries.
But right? David, I think one of the reasons that those boundaries are broken down is because of the change in the nature of food. One of the things that I observed in countries like France and Italy is that because the food is of such higher quality, people are satisfied with less. My own experience is that if I eat something really wonderful, I'm fine. But if I eat something that doesn't satisfy me, that's not good, then I want something else. And I think the food we now provide out there, people are eating more and more of food that is less and less satisfying.
I mean, look at what we're eating. I mean, pick an appetizer, right? In a modern American restaurant, right? I mean, pick buffalo wings, right? So you take the fatty part of the chicken, you load in 30-40% fat in the manufacturing plant when it's fried first. You take, in the kitchen of the restaurant, you load in you fry it again, it's another 30-40% fat. The red sauce, what is it? It's fat and sugar. The white creamy sauce, what is it? It's fat, sugar, and salt. What are we eating? We're eating fat on fat on fat on sugar on fat on sugar and salt. You're not eating that when you go to Europe. And that's right. We've loaded and layered fat, sugar, and salt into this diet, and we've made it available all the time. And we've made it socially acceptable to eat anytime.
Yesterday we have breaks at this conference for food tastings, and there were some lapses here because, usually we're very careful about what we put out. And yesterday, at the break, they came around, there were, some good things, but they came around with this huge platter of deep-fried artichokes stuffed with something, and with a fatty dipping sauce. I would never eat something like that, but, I couldn't stop looking at it, and I finally ate one. And then I ended up eating 2 or 3 of them at a clip, once I started to eat that. Normally, that would never even cross my radar.
You heard it here, folks.
Next topic.
So I think that, when you start to eat this stuff, it produces...
There's a scientific... You prime yourself, right? I mean, this is conditioned and driven behavior.
So I would say what's changed is it's the boundaries broke down as a result of the flooding of the American diet with this kind of food.
We also gave up smoking. I don't know about you, but that changes the way people eat as well. So part of the question I have is, do we have to create a communication strategy where we shift the social norm? I mean, Biggest Loser's on, Food Revolution's on. I mean, people certainly are trying to do this. Andy and Sanjay are using the media very effectively to educate people. Like, is it shifting the social norm? Is it revisiting cheaper food and the Farm Bill issues?
We're all wired to focus on the most salient stimuli in our environment. I mean, for some people, that could be alcohol, tobacco, illegal drugs, gambling, sex, right? But what's the most socially acceptable salient stimuli? I mean, in our environment, it's food. And what has the food industry done over the last 4 or 5 decades? They've tried to optimize and make food even more salient and available and accessible. That's been the business plan of the modern food corporation.
So I'm going to leave us in this space for a while, because clearly I don't know that we have a resolution right now, but maybe we'll get to one.
There were genetically engineered tomatoes that produce nicotine in them, so maybe that's a solution.
But that was the...
Wait a second, but don't leave with that.
Do you have an answer for us, David?
Don't leave it quite yet, okay? Because how do you really change it? Right? I mean, how do you change, if I look at that huge plate of fries or that plate of McNuggets or those buffalo wings and say, that's my friend, that's going to make me feel better, I'm going to finish all of them, right? So how do you change, when you're dealing with reinforcing stimuli? And we really have to change how we look at food. And we have to question, and I think it is fair, maybe not, I don't think we put all food in the same category, right? I think when you look at these huge portions of food, this food that is layered and loaded with fat, sugar, and salt, that is highly processed, right? I think it's okay to question and put that in a different category, than real food.
But shouldn't we change the word food? I mean, right now this word is used for everything. Good, bad, or indifferent, right? Is there a better term we can use for good food, right? Whether it's foodies or junk food, it's called food right now.
Real food.
I think real. When you process food, you take out anything objectionable in it. You add fat, sugar, and salt into it. This food is so highly stimulating and goes down so quickly. Right? It's adult baby food that we're eating. And I think that we do have to, I really do think, I don't think it's laws, I don't think it's regulations, I don't think it's lawsuits. I think in the end, it's how we perceive what we want, right? And I think, your point, of getting us to look at food that tastes good, that is nourishing, that is real food, is the only real hope here, that I know of.
Unfortunately, if you look around the world, and Sanjay, I wonder if you have any examples of this, generally the pattern we see is going in the wrong direction. In every culture, as this stuff is introduced, the changes are going like our society. Are there any examples that we see where it's being reversed, where people are going back from synthetic food toward real food?
I haven't really. Some of the more, the good examples, like Okinawa, for example, which was notable for how long people lived there, the highest concentration of centenarians. They are starting to be sabotaged by some of these same things. In part, again, though, I think economics do drive it because the food is cheaper to produce, and so even in places around the world where you're trying to find cheaper food, those become pretty good alternatives. I do think, though, and again, this may be one of those things where no one really knows the right answer, whether or not to try and make those foods more expensive or to try and make healthier foods just as cheap, I think is a worthwhile sort of discussion. And I think that, the fact that apples and pears and foods that we consider real food, healthy food, are considered specialty crops, for example, in this country. They hardly receive any subsidy funding to try and grow them, I think is a real problem. And I, David, I guess I'm still trying to sort out, are you, if food is laden with fat and salt and sugar, you're saying we're just more likely to eat it. So that part of the problem is not solvable, from what it sounds like you're saying. If you are presented, as Andy was, with a deep fried artichoke versus just a plate of cucumbers, you're always going to go for the artichoke.
No, what you will...
I mean, are we doomed, I guess, to that sort of thinking?
It depends how you look at it. I mean, it depends which you view as, giving you pleasure. I mean, not to do a plug, but it was interesting. Chip Kidd did the cover of my book, and he put carrots and he put carrot cake, right? And here's one of the great graphic designers. And it took me, 6 months to realize that if you understood that cover, you understood the neuroscience of eating. Because where does your attention, if I showed you this great piece of carrot cake or these carrots, where does your eye go? Right? What do you look at? And that tells you, for some people, about 15% of the population will focus on the carrots. The rest of us will focus on the carrot cake.
So I have you mentioned pleasure. And last night during the professional conference, there was a great talk on fire in the gut and GI issues, which is pain, the pain side of the house, right? And they talked about, maybe Andy, you can expand on it, the overuse of proton pump inhibitors to reduce the pain, so that maybe all you experience is pleasure from fried food and you don't understand that it has a negative consequence. And I think that maybe it's not as simple as just avoiding it. Maybe there are other things we can think about.
My favorite, I wish I could show it to you. This is a few years ago. There was a commercial on television for some over-the-counter antacid product. I don't remember what it was. And there was a series of these where a mother is in a car with screaming kids who they've stopped at some fast food place, and the kids are urging her to eat onion rings, and she can't because she gets terrible heartburn. And the solution is then this stuff, you take it, and then you can eat the onion rings. And so, I mean, that seems to me a way that not only our society, but medicine has gone. It's not to pay attention to the signal from your body, it's to suppress that. And the overuse of these proton pump inhibitors is one of I think, the most awful examples of over-medication and completely wrong thinking of how to deal with the problem. And the consequences of overuse of these drugs are dreadful. Some of them are never even talked about. I mean, one of them is that stomach acid is your main defense against infection coming in by the oral route. And with all these people walking around with no stomach acid, I think we are breeding worse and worse strains of gut infections that are going out and infecting everybody. Not to mention the fact that these probably increase the rates of cancer and osteoporosis and so forth. And they're given out like candy. People come in and say, I have heartburn, my stomach hurts, and instead of asking people for a dietary history to ask them what they're eating, the reflex is to just give them a pill.
And it was really interesting to hear in this study that perfectly fine people who took it ended up with the problem after taking
Yes, if you
drug.
take normal people and put them on one of these drugs and then stop it suddenly, they will get heartburn and reflux. That can't be the right way to manage this problem.
But going back to Sanjay's point, I mean, the good news is that our behavior, right, is conditioned and driven, right? So if you whatever I ate yesterday, and the type of food I was eating yesterday, is likely that I'm going to eat it today. Right? I mean, because I'm going to condition myself, and the more I eat it, the more I'm going to do it, and the more I'm doing it. It's not just pleasure. It's not liking, and this is important because there's areas of the brain that deal with liking, but the real thing that's driving this is, and they're linked, and you've got to be careful, is wanting. But I can change that. And one of going back to salt, one of the questions is, can we reduce the level of salt without, in the population over a period of time without changing pleasure? And I think the data that we have so far suggests that the human palate is highly, we can drive those kind of changes. Now, in essence, they're big experiments, right, that we have to do. But if I start, I went to Wolfgang Puck's restaurant in Southern California. And I introduced myself. There was this big plate of food on the table, and I said, what is it? Why are we eating all this stuff?
You said that to Wolfgang
I
Puck?
said this to Wolfgang Puck, and it was very interesting. I mean, he came out. He said he first said it is sugar, fat, and salt.
We need the accent.
Right. But then I said, but how did it happen? He said, we did it together. The first time I served it and made it bigger, I mean, people didn't eat a lot of it. Right. The second time they came in, they ate more of it. The third time they came in, right, they ate it all. And we did it together. And I think the food industry, I mean, and what our behavior is together, I mean, we've delivered the current environment that we're in. And because of that, I think we can change it. It's going to be the hardest public health challenge that we've ever faced.
So we've said make good food cheaper, change the meme, and maybe allow people to feel a little bit more pain instead of just the pleasure. So we have a couple of options here. I want to switch topics to a couple of different areas because we're talking about overall wellness. Sanjay, a lot of us have heard about your harrowing experiences in Haiti. We've seen your reporting on Katrina and H1N1 issues, and I work a lot on national security, and I always think that health and national resilience go together with feeling more comfortable and more secure. So how did these experiences, and having been in places that most of us haven't seen, what have you learned from that about overall health, resilience of the populations, what's required for us to be able to, as I like to say, surf the circumstance of whatever happens to us?
That's an interesting question, and I think that if you look at a place like Haiti, for example, they don't obviously get to sit down and have discussions like the one that we're having now, and to sort of deal with some of the issues that we're trying to tackle. I mean, these are high-class problems, as my father always used to say. With regard to resilience, though, that's a fascinating issue, and I think that what I've noticed after covering wars, after covering lots of natural disasters, tsunamis, hurricane, the earthquake in Haiti and Pakistan, all over the world, is that there tends to be what people refer to as a heroic period right after something like this happens, where people genuinely are resilient. I mean, they're trying to help their fellow citizens. The people galvanize, they donate, they give blood, they do whatever they can. And then within a period of time, and it's usually fairly predictable, that starts to go away. In part it's media coverage's fault that we start to go away. In part it's because that reality sets in of what's actually happened to them, and the resilience starts to wear down. So I think that overall the level of resilience may be higher in these places that have endured such a thing, but I think that it does start to diminish with time. I don't know how to draw a parallel between that and predicting a state of health in a particular country, 5 or 10 years down the line. To get Haiti, for example, back to where it was one day before the earthquake will take 4 years. Mm-hmm. But that was a terrible place. It was a terrible place. I mean, they had no medical infrastructure. They had terrible access to food, real or otherwise, of any sort. And if the goal is to ultimately create a healthy place to live where you have a booming tropical fruit industry, you have more skilled laborers per capita than just about any other place in this hemisphere, you have a potential tourism industry, you could create something out of Haiti that would allow some of those parameters by which we measure health success in so many places around the world to actually occur. But that's often not sort of foremost in mind.
I think it's interesting in the U.S. Last year at the panel we talked about H1N1 and whether or not increasing your immune system was a good thing. Given that we talked about was after Katrina, if you could walk 10 plus miles, you might have been able to get out of the critical disaster. It's sort of, do Americans need to think differently about their overall well-being instead of being afraid of the normal course of events, whether it's flu or whether it's weather or something else that happens to us?
What I find to be an alarming trend here, along with growing obesity, is the rate of diagnosing depression at all ages, especially in kids. and the rate of dispensing psychiatric medication for that. And many people have observed that the emotional problems that we have in our society are much rarer in societies like Haiti and among people that have much less. And I think you can make a very reasonable argument that depression is a disease of affluence, as obesity is for us at the moment. And it's interesting to think about that our resilience may be threatened by our abundance.
So I'm going to shift again to environmental health. I think the recent research was talking about 232 chemicals found in the umbilical cords of newborns, and what we're starting to see, saying, do we have to worry more about the environment and environmental chemicals in our health than we ever have before? I know we frequently in the conference have talked about water as a delivery mechanism for some of these things. So for the public here, how should we think about those?
But, and it's worth pointing out, just recently the President's Commission on Cancer also released a report. This was just, I think, end of last week, saying that in essence, there are probably lots of chemicals, potential environmental toxins out there that are very problematic that we simply haven't studied yet. And I think they really narrowed in on 5 of them. I can't remember what they are right now, but I think radon, BPA were a couple of them. And this was probably the strongest worded statement, I think, from the President's Commission about this. I mean, there are, I think, 80,000 different potential environmental toxins out there. And when this act, the Toxic Safe Chemical Act, was created, there were 60,000. So, and that was in, I think, 1970 sometime. Since that time, only 200 chemicals have really been studied, and only 5 have been restricted or banned. So I think the real answer is we don't know. We just don't know. We haven't done enough studying to know whether some of these environmental exposures really are problematic. But I think there is real concern that they could be.
And I would say, and I'm sorry to say this, I don't think you can rely on our government to protect us in this area. Because when the government, and here especially, I think it's not quite as bad in Europe, is faced with a choice between public health and private gain, it almost invariably sides with private gain. And we've seen this very recently in the case of BPA, where the FDA was unbelievably reluctant to take any action against this chemical. So I think it's up to us to become informed, and I would say in the absence of definitive proof, it is very good to apply the precautionary principle. Mm-hmm. And to err on the side of caution and to limit, to the extent that you can, exposure to these agents that are potentially harmful.
Yeah, I really agree with that. I think in part maybe because I'm a relatively new dad now. I think about this more than ever before. But I'm always struck by the story of lead.
Yeah.
And 40, 50 years ago, a certain level, 60 micrograms per deciliter was the level, was considered the upper acceptable limit of normal. You could have that and still be considered to have a normal lead level. We now know that if you had that lead level, it caused cognitive deficits, it caused possibly solid organ tumors, it could cause central nervous system disturbances. That was considered normal. And now science caught up, and now we say no safe level of lead. What is the next lead? I mean, is it
exactly.
EPA? Is it? And I just think the science is going to catch up, and we don't. I think it's fairly easy to exert some of those precautionary principles, as it turns out as well.
And there's so many historical lessons here that are reason for caution. I love to talk about my experience of growing up in the late 1940s and 1950s when all shoe stores had fluoroscopes. And you stuck your feet in the new shoes under the fluoroscope, and there's a big glowing green screen, and you saw the bones of your feet. And the game as a kid was to distract the shoe salesman who was trying to show this to your parents so you could spend more time under there irradiating your feet.
Is that what happened?
Yeah, that's what happened. That caused it, right. That led me to eat that artichoke. But why I like to look at these examples is that it then makes you think, what are we doing today that 50 years from now we'll look back on with the same disbelief, how could we have let that happen?
So practically speaking, what do you guys do in your own life to protect yourself from these things?
I purify my water. I have well water, which among other things has a toxic level of fluoride in it, and I use a distiller for drinking water. I grow a lot of my own food. I shop for organic produce when I can, but realizing that organic produce is more expensive and sometimes not available, I think it's very important to familiarize yourself with which crops are most likely to be contaminated and which aren't. And there I turn for guidance to the Environmental Working Group in Washington, which has just published a great shopper's guide to pesticides. And they put out the Dirty Dozen, which are the most contaminated crops, and the Clean 15, which are the least. So, if you're thinking about buying peaches or apricots or green beans, which are on the Dirty Dozen list, I would say I don't eat them, or I get organic versions. But when it comes to onions, avocados, bananas, which are on the Clean 15, I don't care. I have phased a lot of plastic out of my life, and I think many of the plastics that we now accept as safe, these are things that may not be safe and look safe in the future. I don't keep poisons around my house. Even though I live out in the Arizona desert, I've never had exterminators come in. I've never used poisons. I really don't have problems. Occasionally find a scorpion, I usher it out. But I'm not bothered by insects. I think it's not good to keep poisons around the house. So those are some basic rules.
We recently had to paint my office, and nobody could work there for 4 months because of the off-gassing. And interestingly enough, we had to bring in new painters, prime with low VOC paint, and repaint it. And the painters were Snoopy dancing. They had their heads in the can saying, we've never experienced a painting experience like this, which to me says not a lot of the market is really moving in that direction. It's expensive. So,
well, it'd be nice if these alternatives were cheaper, not more expensive. That's again the backwardness of the way things are structured.
I think at an individual level, I think it is more expensive. It's interesting. I had a similar experience to yours. We were trying to put in new cabinets, and I don't know if Laura Seidel is here, but I was talking to her one day, and she basically said you really got to be careful of the type of glue they use in cabinets, because it's got a formaldehyde base to it, and that off-gasses for a long time, and again, especially around children, but adults as well, that can be very problematic. So that was my mission, was to try and find this glue that did not have a formaldehyde base to it, and it was far more challenging than I would have thought, and in the end, I couldn't even be convinced that in fact it didn't have it in there, because it's very hard to actually test that sort of stuff. And we do a lot of the same things Andy does. We try and buy local produce as much as possible, buy local. I think that is something, we've really cut down on plastics. We do simple things, with the baby bottles and things like that. But we also use geotherm in our house, for example, to try and cut down on potential exposures. But, I do think it's interesting, and you can, for example, with the production of PVC, polyvinyl chloride, I think there's pretty good evidence now that you can produce this in a mass way without actually adding a lot of additional costs.
That would be great.
I mean, they've shown this in Europe.
Yep.
And in fact, in many ways, they have different product lines for Europe versus the United States. The stuff that they're still making the old-fashioned way, they'll dump off on the United States because we don't have a lot of the regulations, whereas they'll keep a lot of the products that are made in the green chemistry sort of way in Europe.
Interesting. So to switch topics again, now back to ingestion. The question that comes up a lot at the public forum discussion is talking about what do we need to do to enhance our health? How do we get better? Which brings up the issue of supplements. Should we take them or shouldn't we? Do we counterbalance our pleasure with a little extra boost in order to give us more health if we're eating things that aren't so well? Do we go for vitamin D or not? It's like, what's the opinion of all of you esteemed doctors?
Well, you know my position. You've heard me say it. I don't think that dietary supplements are substitutes for the foods that contain them, because at best they're